a natural disaster of a sort. And with the change in the normalcy of the situation, there's bound to be a lot of emotions and feelings emerging. So I think it's really the need of the day to be focusing on those and talking about emotions, feelings, and mental health concerns. I will start with giving a little bit of background on the natural phases of disaster that happened during any natural disaster, keeping in mind that this situation is a little bit different from any usual natural disaster because of the whole aspect of social distancing and communities not being able to come together, people not being able to gather together for support or for thinking about ideas and ways to get over this crisis. But let's talk about what the phases that usually happen when we are in a situation of a natural disaster. The first stage is called the pre-disaster stage, in which you first hear about the warning or the threat of the natural disaster. And for us in this situation, I think it was the phase where we heard about, the things happening in far-off countries like China or Italy, and it didn't really hit us that we will be affected by this very soon as well. And this was a situation in which people were wondering whether they were overreacting or underreacting, and sort of just letting things sink in and figure out how they wanted to feel about this. This stage of pre-disaster was followed by the impact phase, where there was heightened intense emotions. There was disbelief, there was fear, there was shock. People didn't know what to think about this because it had finally begun to sink in, but the emotions were at a rise. The impact phase lasts for a couple of days, and then it's followed by something called the heroic phase, where everyone wants to. So there's a lot of activity, but very little productivity. Right. So I think in our situation, more than physical activity, there was a lot of social media activity going on, social media and mainstream media, where there were all kinds of theories being floated around. People were talking about different ideas, conspiracy theories, what this means and what this doesn't mean. And there was so much going on, but very little productivity. And after the heroic phase passed, we came into the honeymoon phase. And I think that's really what's going on right now, where it finally sunk in that this is something serious. And people sort of accepted it, began to adapt. We heard things about people saying, things like, it's okay, this almost feels like a vacation, I'm bonding and connecting with my family, and we're relying on home cooked food and homeschooling, and things are going so well. So we heard all these things, and it almost seemed like people were enjoying this time. There was outpouring of support. People are being empathic, supportive of each other. And this phase usually lasts for a couple of weeks, and is then followed by a phase called the disillusionment phase. And that's my concern, that once this honeymoon phase is over, we will see that people will be depleted of their emotional reserves, of their energies and resources. People who are affected will be in want of that support and that help, but might not be able to get it. And that's where anxiety kicks in, people start feeling overwhelmed and exhausted, and a lot of mental health issues start emerging.
Right. So with that brief overview, like you just said, these are testing times for all of us. It is hard enough to sit at home, and then there are the worries of our own health, the health of our loved ones, and some people even have to worry about their jobs and finances. So in this scenario, Dr. Madhya, what are the mental issues that you see emerging in the near future, like once the honeymoon phase is over, or maybe right now in a day or two?
Right, absolutely. Like you said, these are testing times. These are very difficult times. And people are worried about so many things, not just their health and the health of their loved ones, but also about finances, about the future, what's going to happen, whether there will be pay cuts, which people are talking about right now, whether they will potentially maybe lose their jobs. What does this look like for the world in general? Would we be living in a very different world going forward? So yes, I think underlying any mental health issues are usually feelings or emotions. And the emotions that we are going through right now are emotions of fear, uncertainty, feeling overwhelmed. And all this can give rise to a lot of anxiety. right? So anxiety is something that we are primarily dealing with, and maybe will be dealing with even more so as this situation progresses. So understanding that right now, everyone, pretty much everyone, is in a state of anxiety, is in a state of worry, thinking excessively about the future, about what's going to happen, managing things right now with the whole model of the world changing. People who had never worked from home before are starting to work from home. It's seeming to be quite difficult for some people because their work-life balance has really been upset. People at work are not realizing that, there is uh, work is home and home is work, right? So there's really no limit on when to reach out to your employees, when to ask them to do something, when to meet deadlines, because it's not like work stops after 6 or 7. That person has a home office, they're sitting at that home office, and people expect them to work all day long. Same thing goes in the other scenario where these people are, they can't manage, or they don't know how to manage being in the home environment and being completely focused on work, because in the background, there are kids running around, there's things happening. And when people know that you are at home, if an emergency situation happens, or even not an emergency, something urgent, they will reach out to you. So really managing all that can be very exhausting and overwhelming for people. So increased stress and anxiety associated with the changed models that we're seeing. uh, People feeling more moody, more irritable, depending on what's going on in their personal lives, as well as when they look at news and see what's going on in the world. It's absolutely going to increase the feelings and emotions that people have regarding anxiety about this situation. So I think it's important to keep in mind that that's going to happen, right? Depression is something that we will see happening more and more, because as people see suffering, pain, losses, there's bound to be feelings of sadness, and feelings of sadness are completely natural and normal, right? When they do become a psychiatric disorder, or when do they become what we call clinical depression or a major depressive disorder, that it's when these feelings become prolonged, when they start affecting your day-to-day routine activities, when they start coming in the way of your relationships, or when they start coming in the way of life in general, when you start feeling like you're a different person, right? That's when these things really become disorders. So anxiety, depression, we see impact on people's sleep and appetites, not wanting to eat the way they used to, not being able to sleep at night, because our minds are, and the way anxiety works, it does so in a very counterproductive way. So when our bodies know that this is the time to put the mind to relax or to rest, is the time when anxiety decides to kick in. And when anxiety decides to tell you that things are horrible, things might become devastating, it'll put ideas in your head, like give you the worst possible scenarios about, I hear people talking about, is this ever going to be over? Will any of us be left alive? Will we run out of food? Will I not have food to feed my children? Am I going to lose my parents and my loved ones? So anything, the worst possible scenarios that you can possibly imagine will kick in at night and interfere with sleep, keep you up at night. So those are some of the common things that we hear about. Some of the ones that we don't hear about so much, but will definitely be impacted, are things like drug use. Now, that's a kind of a taboo topic to discuss in Pakistan. Um, but this is happening in Western societies. I'm sure this is happening in Pakistan as well, maybe not talked about so much. But drugs like marijuana, alcohol, that seemingly that make you think like they can be calming, in situations of stress, people start relying more and more on them. People who are already using them, or people who never use them, there might be a new emergence of cases where people will seek out these ways to self-medicate, right? Um, so we have to be aware of the possibility of these things happening, keep an eye on them. And what drug use does is, not only does it have adverse effects on your health, but also on your mental health. If they can add to issues like violence, which is another important topic to talk about. When you're cooped up in a house, households who already have issues of domestic violence, that may possibly rise, or there may be new emergence of cases of domestic violence. And if you add drugs in the picture, then it just makes it worse. right? So drug abuse, domestic violence, these things are important to keep in mind as the situation progresses. Child neglect or maltreatment for mothers who have multiple children and don't have enough help is something again to think about. Burnout, not only in people who are working from home or are essential workers who are really in the front lines and fighting this war, but also in a population that we don't talk about very much, the homemakers. There's a possibility of them experiencing burnout because situation for them has changed very much as well. Everyone is at home, there's more work, mothers have to make sure children are being homeschooled in the correct way, and on top of everything else, all other responsibilities they have, and then some people don't have domestic help anymore. So knowing that burnout could happen and can lead to increased anxiety and depression is important as well. Grief is something that we're all possibly experiencing right now or may in the future. If something happens to our loved ones, or we hear about something happening to people close to us who are losing their loved ones, then we have people who are fighting with this war, and they're experiencing people dying in front of them. So trauma, grief, all these things are very important to think about. So I think mainly those are the topics or those are the issues that we have to keep in mind going forward.
Right. So sum up, I think if there are a few things that you just mentioned, you talked about anxiety, you talked about conflicts in relationship, you talked about burnout and depression, insomnia, and grief. So this is something that we can expect to see throughout the general population. But if we, kind of focus on the medical health professionals, and especially our platform is also kind of, focusing more on the doctors and the health professionals. What do you think what is, the main issue that you see is possibly arising in them in terms of mental health issues?
Right. I think that's a very important question. So basically, we have two kinds of health professionals right now. There are ones like me who have what we can say the option or the luxury to sit at home and do their work from home, right? So telemedicine is a new concept. Doctors are adopting that. And we're using technology to connect with patients, to see patients through telemedicine. I think it's all very new for us. So there are some struggles associated with that, some technological issues. But I think that's very similar to what every other professional might be experiencing. Thinking about finances, thinking about what's going to happen, the future of healthcare and all that. So those are some of the concerns that some healthcare professionals might have, right? Which may be very similar to the general population. And then we move on to talk about the concerns of the health professionals who are in the front lines. And for them, this is all very, very serious, because these are the people who are fighting this war for us, right? Imagine being an ER physician, an infectious disease specialist, an anesthesiologist, a respiratory therapist, or a nurse. Anybody who's coming into direct contact with a COVID-19 positive patient and working closely with them, possibly touching them, standing very, very close to them, intubating them. Knowing all this time while they're helping save lives, that they're putting themselves at risk, this constant thought going on in their minds that we are exposing ourselves. By just working, we are exposing ourselves, right? We are at the risk of getting this infection. And then when they get done with that work shift and go home, then being really scared of the fact that they might be taking this infection back home to their families, to their children, to their spouses, to their parents, to their loved ones. And that feeling being extremely difficult to deal with. Another thing that we're not talking about so much, but what health professionals are facing is stigma, right? People wanting to isolate them. And yes, that's the need of the day. It's very important to be careful regarding your work situation and what you do without it, but also feeling like everyone kind of wants you out of their space. and having to deal with that because emotionally they're already exhausted, and then feeling like, all people care about is, hey, they might be bringing the infection home with them or wherever they go. So I think it's a very difficult situation for them in general, being scared the entire time, almost like a soldier would feel in a war zone, being in a state of hypervigilance, being in a state of constant anxiety, wondering what could happen, when it could happen, would I die? Now dealing with patients who are suffering, who are in pain, who have difficulty breathing, and imagining that this could be me because potentially I am putting myself at very high risk of getting this infection. Dealing with pain, with suffering, with trauma of losing patients, of losing co-workers, and not having enough time to maybe even talk about those feelings because they're also overworked. They're also overloaded. So feeling physically exhausted, emotionally depleted. And then on top of that, maybe having feelings of wanting out, right? Feeling like I'm not up to this at times, but since we've all taken the Hippocratic oath, we know that this is a situation where we can't back out, and then feeling guilty about having these feelings in the same place. So it's a very complicated situation, and this is the time when all should be supporting our frontliners in every way possible, because we should be giving them space to talk about how they're feeling, to talk about their fears and their concerns, in a way that nobody judges them, and just so they can feel validated, and somebody can give them the empathy that they need. So I think mostly that's the situation that the frontliners are going through.
Right. So if I just quickly sum up what you just said, the one of the main things that I identified from what you just said is that on top of all these feelings, they'll be feeling guilty for feeling all of these things. So that is one of the things that needs to be addressed, and we need to kind of have regular sessions with them, and make them feel that it is all right to have these feelings, to be overwhelmed and to feel just anxious and sad and depressed for whatever's going on around them. So with these issues identified, Dr. Madiha, can you give us some tips to deal with all these emotions, not just the general population, but also the doctors, the frontliners that I'm sure are really in need of it at this time?
Right. So I think the first issue at hand is understanding and being aware that these are possibilities. These are the things that we should almost be expecting or knowing that they will happen. I think it's very important, right? Because when we understand and when we know, we'll have a plan. We can have preventative measures. We can have support groups, or we can start working on ideas of how we need to provide support to the general community as well as our health professionals. And unless we think about these things, we can't come up with ideas to provide that forum. So I think the first thing is exactly what we're doing right now, talking about these issues, knowing that these issues exist and how we can tackle them best, right? Because honestly, if at this time our doctors lose morale, there's very little that they'll be able to do physically. So I think this is not an issue to be taken lightly. This is something very serious that we all should be thinking about. The momentum has to keep on going, and support has to be there for that. So I think that's important. Then sometimes the language that we use, or the way we normalize some of these concerns, is very important as well. At this time, telling people or using appropriate language for them, and validating their feelings, telling them this is something very normal, this is something that a lot of us are going through, having some sleepless nights, feeling anxiety, feeling panicked some days, that in a situation like this, it becomes more normal, right? Now it does, at some point it might become a disorder, but this is not like normal life. This is a global crisis. So there might be more days you experience anxiety, which you never experienced before in your life, right? So to a certain point, normalizing that. Also, as much as we are talking about sort of all these scary ideas that this might happen or that might happen, just to prepare ourselves, I think it's also very important to give a message of hope, to let people know that pandemics have happened in the past. This is not the first time, and that inshallah, most of us will come out of this, the vast majority will come out of this doing relatively well. So we need to focus on that, that this will end. This started naturally. There will be a natural end to it. And most of us will come out doing relatively well. So we need to focus on that, right? So definitely giving people a message of hope, support each other, um, and bonding over these one population that we don't talk about or focus on so much is children. uh, for them, this is again something very new, very strange. I think they should be talked to, explained what is happening, what's going on. Their questions should be answered. They shouldn't be left feeling like, okay, this is what it is. This is the new life. You deal with it. You don't have school anymore. You have homeschool. No. Children of any age, they should be talked to in an age-appropriate manner and explained to some extent what's going on. And a lot of times, adults don't realize that they're having these kind of scary discussions in front of their children, or where their children might hear them when they're talking about deaths happening, death rates in different countries, discussing statistics, and they don't realize how much children can get scared listening to information like that. And using their imagination, they can think of anything. Children's lives are very self-focused, so when they think something scary is happening, they start thinking it will directly involve me or my loved ones. So reassuring them, telling them that this is something that we are all dealing with, but again, giving them hope is quite important. Another population that we don't necessarily maybe thinking about right now in terms of their emotional health. We are all concerned about the physical health of our elderly population, but when it comes to their emotional health, I think again, because some elderlies are isolated inside their houses, some are isolated inside their rooms. They're not used to using technology the way the younger population is. So they don't even have that support, right? So keeping that in mind, making sure that they're feeling useful, they're feeling connected is quite important. So maybe doing things like having grandchildren connect with their grandparents, having time where grandparents can read stories to the children, or talk about their culture, or because a lot of times we have multicultural families, people living in one country and there are other family members living in another country. So make use of that. Have your children connect with their grandparents, make them feel useful, make them feel like they are contributing to the society as well, and feeling connected to everyone. I think those are some important things we should be thinking about. Another very important thing is maintaining a routine, a structured and healthy routine, making sure you're sleeping on time, you're waking up on time, even if there's no sort of restriction on you to do that, but still trying to do that because that's important for your health. Including physical exercise of some sort in your daily routine, eating healthy, doing activities with the family, connecting with each other. That's all very important. Being supportive, and then comes the question of medication, right? At what point do you seek out professional help or think about medication? So I would definitely want to emphasize on patients who already have mental health issues, chronic mental health issues, who've been taking medications for a long time, to please continue taking their medications. This is not the best time to try to wean yourself off of your medication. Be in touch with your psychiatrist or with the physicians who are treating you. Make sure you have refills, or if there's an emergency, know the plan, know who you'll have to reach out to in case you have a panic attack or something like that. People who might be thinking that this whatever they're experiencing, whether it's anxiety or depression, is becoming too prolonged or too severe, then that would be the time to get in touch with professionals and find out if they need the help of medications and being treated. And psychiatry is one field that is being very effectively practiced through telemedicine. So again, it's very easy to find professionals who are practicing that and connect with them. So I would say keep all those things in mind.
Right. So basically, this is a time of negative emotions. All we've been talking about is negative emotions right now. That can include anxiety. I think is on the top of the list, which a lot of us are facing right now. every itch in the throat seems like corona, or seems like, a death certificate to us. So how do you suppose we can channelize these negative emotions into something productive and something positive?
Right. And I'll come to that question, but what you said just reminded me of something else, something that we missed talking about when we were talking about the different issues emerging. And one aspect of anxiety is exactly what you just said, people feeling these physical symptoms or these bodily symptoms. And usually, what we call psychosomatic symptoms, when they are presented with anxiety, usually it's like chronic pain, headaches, fatigue, nausea, something like that. But in this particular situation, a lot of what we're seeing is people believing that they have the infection. And as we've all read about the different symptoms of the infection, we've probably memorized them. So, a lot of people are just starting to believe they have a dry cough, they have fatigue, body aches, headaches, trouble breathing, chest pains. And for every one person who's truly positive for the infection, there will be 2 to 3 others who are just presenting. And these people will not present to psychiatrists, obviously. They will present to their GPs or to the ERs with these symptoms. And the problem with that is that our medical systems can become overwhelmed with these patients. So it's really important to keep anxiety in mind and to provide reassurance to people and to explain to them that what they might be suffering from might just be anxiety and not really the symptoms of of COVID-19. And then coming back to your question about how to channelize all our emotions into something positive, I think that's a very, very good question, because we don't know how long we are in this situation for. Um, so I think what we need to focus on how to make the best of the situation, right? And the first step to do that is to accept. Acceptance has to come in that this is what's going on, instead of kind of focusing on going over and over the statistics, the new cases, what's happening in which country. I think that's all very important, but also knowing that this is a difficult situation, and it's probably not going to be resolved in a few days. So let's just accept this is the situation for now, and then how to adapt to this new situation, right? Yes, the shock is there, the grief is there, the loss of the normalcy of the life is there, but okay, what do we do now with ourselves? So sort of coming to terms with that idea, I think, is really important. The other very important thing is empathy or kindness, with yourself as well as with other people. We all have very different ways of coping with difficult situations. So making sure we're not being judgmental of how each one of us is reacting to this. I know, in families, there's so many arguments going on about whether this is a conspiracy theory or really a virus or something else. And when emotions become so high, people start arguing with each other. They don't have enough tolerance for each other, and especially when what we talked about in the beginning, this honeymoon phase is over. Irritabilities will rise. People will just, sort of be emotionally depleted to a point where everything will sound annoying to them. So that's the time when we have to realize that everyone has a different way of coping with stress, and let them deal with it the way they deal best with it, right? This is not the time to be unnecessarily preaching or educating people, or necessarily getting into confrontations and arguments. Give people space, be non-judgmental, and be supportive, be empathic. I think that's really the message that needs to be conveyed. Um, Also, this is the time when, fortunately, we're seeing a lot of people sharing their talents, their skills. This is the time to be giving, right? And giving can be done in so many ways. I think it's very heartening to see in Pakistan, there's all these campaigns going on for ration distribution, for the daily life that people are doing that. The momentum should just be maintained, that people continue doing things like that, thinking of the less fortunate ones or the less privileged ones, maybe coming up with ways where, I remember when the earthquake occurred in Pakistan in 2005, students were getting together, thinking of ways to, collect money, funds. to help other people. The problem with this time is that we can't physically get together to do those things. But I've been hearing of young students making support groups where they're taking turns. One person goes out individually to get groceries for elderly people and to deliver them to their houses. So if this can be done in a safe way, right, taking all the precautions, something like this where you can make use of your resources or energy to help somebody else who can't really be out right now because of their increased risk to getting the infection. Those are some of the ideas in which we can give back to the society. And honestly, we talk a lot about giving back to the society or giving to people, and it seems like if we do that, that would be helpful to other people. But what we don't realize is how helpful it can be for us. When we talk about depression, when we talk about feeling like there isn't enough contentment in our lives, giving, research has shown that giving back is the easiest and the best way to bring contentment into your own life and to feel happy. So the quickest way to increase your own happiness and positivity is to give back. So however you can, again, that can be financial, that can be sharing your skills or your expertise or your talent, however you can do that. Please think about doing those things, being creative, doing things with your families that you might have not done before because of a lack of time. This is the time to do those things, connect with people, friends that you haven't spoken to in a long time. Everyone has time now, nobody's going out. So I think this is the time when we can connect with people, when we can find meaning in things that we thought we were neglecting in the past. So this is the time to maybe think about all those things. One other important point that I have in mind that I think is really something that needs to be discussed is distancing ourselves from media and social media to a certain degree. It provides us with important information. It provides for us with an opportunity to connect with people, but at the same time, it can be very harming or detrimental to our mental health. Constantly being bombarded with information, with all these different ideas, and feeling overconnected with people at some times, I think it's good to have a balanced approach about how we can deal with social media. So I think that's pretty much what I have in mind, and I would love to hear if you have something to add.
So we were having some questions pouring in, and one of them I think you just answered. If you want to elaborate a bit more on that, one of them was how to cope up with the rumors that are floating around. So that is basically excessive use of social media and the normal mainstream media as well, where there's a constant bombardment of information, and some of it is true, some of it is not true. So how do you suggest that we cope with all the rumors and all the false information and all the just so much information being bombarded at us?
Right. I think the best way to deal with that is not look at every bit of information that is passed on to you, right? Unless you know that the source of the information is a valid, legitimate source, please do not look at every bit of information that is shared with you. If there is useful information, you will get it. You will get it from reliable sources. So don't think you will miss out on information if you don't watch a video or see an article that somebody passes on to you, because there's so much fake information going around. So many sort of, there's news going around that gives you a false sense of immunity. When people talk about different theories, other people start thinking, okay, so maybe with this theory, we are immune in a certain way. And what that doesn't necessarily just give them hope, but also a false sense of immunity. And they don't focus on what is important to focus on right now, which is social isolation and distancing. So yes, when something becomes extremely important and useful, you will hear about it from reliable resources. Unless you hear from reliable resources, please ignore all information. That would be my advice.
Right, that would be useful. Also, we all know there are certain criteria for diagnosing clinical depression. But then in these times when everybody is feeling depressed and anxious, how do you think we can identify that we're beginning in the beginning phase of depression, and we need to get hold of it or maybe seek professional help?
Right. So, Dr. Madhya, like I briefly mentioned before, anxiety, depression, these are feelings that we all go through, right? And sometimes it's difficult to recognize when it becomes a disorder, something that needs to be treated. So 4 things that everyone should keep in mind is that when these feelings become prolonged, so when you're experiencing depression or anxiety for a couple of weeks, let's say 4 weeks, okay, when you feel like you're feeling them all day long for this amount of time, that should be sort of a warning sign for you. When you feel like it's getting in the way of your normal routine, waking up, getting out of the bed, taking a shower is problematic for you. You're feeling that down. That's definitely problematic, right? When it starts getting in the way of your relationships, you're so irritable, you cannot talk calmly to your children, you're yelling at them all day long, you cannot have a decent conversation with your spouse. Or your coworkers, that's when it's becoming problematic. And number 4, when it's getting in the way of life in general, when you feel like you're not the same person, your feelings are just strange to you. So these 4 prolonged, um, getting in the way of normal daily routine, getting in the way of relationships, or making you feel like a different person, that's when it's not a normal feeling of anxiety or depression. It's probably a disorder which needs to be treated by a professional.
This was a very, very useful talk for me, at least, Dr. Madhya, and I hope everybody who has taken out time to join us feels the same way. So, quickly wrapping up, we have identified a couple of issues and we have identified some of the ways to deal with them. So, stopping them is, again, anxiety and it's grief and it's burnout as well. Burnout, I think I'm getting there. Having to do everything
We
on
all
your
are.
own. Yeah, looking after the house, having to work from home, and having no house help. So it is all just piling up. So what definitely is the take-home message is to learn to deal with emotions and to channelize them into something productive. Have a routine. I think that is very important. Having a routine where you find time for yourself as well, apart from all the other demands of your life, of your daily routine as well. So I think this was a very, very useful session. Dr. Madha, it was great having you here, and we hope to talk to you again sometime.
Thank you so much. It was a pleasure.